What are scabies? How do you know if you have them? Scabies is a contagious skin condition caused by tiny mites called Sarcoptes scabiei. These mites burrow into the skin, where they lay eggs and cause an allergic reaction, resulting in intense itching and a rash. Scabies is highly contagious and spreads through close physical contact, such as sharing clothes or bedding with someone who has scabies. It can also be transmitted through sexual contact. How do you get them? Scabies is caused by an infestation of the human itch mite, Sarcoptes scabiei. The mites burrow into the skin to live and lay their eggs, causing an itchy and painful rash. Scabies is highly contagious, and it spreads through close physical contact with an infected person. Common ways in which you can get scabies include direct skin-to-skin contact. The most common way to get scabies is through direct skin-to-skin contact with an infected person. This can happen during sexual contact, or by simply holding hands, hugging, or sleeping in the same bed. Shared personal items. Scabies mites can also live on clothing, towels, and bedding, and can spread from one person to another through shared personal items. This is more common in places where people live in close quarters, such as nursing homes or college dorms. Contaminated surfaces. In rare cases, scabies can be spread through contact with contaminated surfaces such as furniture, doorknobs, or other objects that have been in contact with an infected person. Scabies can affect people of all ages and backgrounds, and it is not a reflection of poor hygiene or cleanliness. What are the symptoms? The symptoms of scabies typically begin 2 to 6 weeks after the initial infestation, but they can appear sooner in people who have had scabies before. The most common symptoms of scabies include 1. Intense itching. The hallmark symptom of scabies is intense itching, which can be especially severe at night. The itching is caused by the body's allergic reaction to the mites and their feces. 2. Rash. A rash is another common symptom of scabies. It usually appears as small, raised, red bumps or blisters, and it can be found anywhere on the body, but is most commonly found in the folds of the skin, such as between the fingers, on the wrists, elbows, armpits, genitals, and buttocks. 3. Burrows. The burrows are the tiny, thread-like tracks that the mites make as they burrow beneath the skin. They appear as small, raised, grayish-white or skin-colored lines, often found on the hands, feet, wrists, and genitals. 4. Secondary infections. Scratching the itchy rash can lead to skin infections, such as impetigo, which can cause additional symptoms like crusting and oozing of the skin. 5. Other symptoms. In some cases, scabies can also cause fever, swollen lymph nodes, and body aches, but these symptoms are rare. If you suspect that you have scabies, it is important to see a healthcare provider for diagnosis and treatment. How is scabies diagnosed? Scabies is typically diagnosed based on the characteristic symptoms of the condition, such as intense itching and a rash. However, to confirm the diagnosis, a healthcare provider may perform one or more of the following tests. Skin scraping. A healthcare provider will take a small sample of skin from the affected area and examine it under a microscope for the presence of mites, eggs, or fecal matter. Dermoscopy. A dermatoscope, which is a special magnifying lens, can be used to look for the burrows of the mites under the skin. Ink test. This test involves applying ink to the affected area and then wiping it off with an alcohol swab. The ink will stick to the burrows of the mites, making them easier to see. Blood tests. In rare cases, a blood test may be used to check for the presence of antibodies to the scabies mite. Scabies can be difficult to diagnose, especially in its early stages. If you suspect that you have scabies, it is important to see a healthcare provider for an accurate diagnosis. Treatment options for scabies. There are several treatment options available for scabies. The goal of treatment is to kill the mites and their eggs and to relieve the symptoms of itching and rash. Treatment typically involves a combination of medications and hygiene measures to prevent the spread of the infestation. 1. Topical creams. The most common treatment for scabies is a topical cream or lotion that contains a medication called permethrin. The cream is applied to the entire body, from the neck down, and left on for 8 to 14 hours before washing it off. The treatment may need to be repeated in 1 week to ensure all mites and eggs have been killed. 2. Oral medications. In some cases, a healthcare provider may prescribe oral medications, such as ivermectin or stromectol, to treat scabies. 3. Antihistamines. Antihistamines, such as Benadryl, can be used to relieve itching. 4. Hygiene measures. It is important to practice good hygiene measures to prevent the spread of scabies. This includes washing all clothing, bedding, and towels in hot water, and drying them on high heat, and vacuuming carpets and upholstery. 5. Isolation. Infected people may be advised to isolate themselves to prevent transmission to others. It is important to treat all family members in close contacts, even if they do not have symptoms, to prevent reinfestation. Your healthcare provider can help you determine the best course of treatment for scabies based on your individual situation.